Dear students, very good afternoon everyone. This will be the last session of the day. Is it audible? Yeah.
Yes, sir.
Okay. I hope you are not bored of all these lectures. It's inevitable. Okay. Yeah. So today I'll be dealing or I'll be talking mainly about history of medicine and alternate systems of medicine. Okay. I am Dr. Madhu, Associate Professor of Medicine. Excuse me. Just give us a minute. Yeah. Uh, sorry for the disturbance. There was some technical problem. So see, those who fail to read and understand the history are destined to suffer the repetition of its mistake, or you will be repeating the same mistake. So knowing about this is our ancestors, our history, our previous technologies are very important. We should know how we have evolved, treating all the ailments, preventing all the diseases up till date. So I repeat, those who fail to read the history are destined to suffer the repetition of its own mistakes. So medicine in antiquity. How was medicine when everything began, when the earth began? So when humans, when the first man or the first woman, how did they treat the disease? See, during ancient times, health and illness were interpreted in a cosmological and anthropological perspective. So medicine was dominated by magical and religious beliefs, and it was part of ancient civilizations. So it was part of their culture also. So this was how in ancient times they used to treat the disease. So they used to believe that it's a cosmological or a magical thing. Okay. So what happened next? So this is preventive medicine. Medicine was conceived in sympathy and it was born out of necessity. They say that medicine was conceived in a sympathy and of course it was born out of necessity. So since knowledge of primitive man was limited, they attributed humans suffering to wrath of gods or invasion of our body by evil spirits. So eventually, as a logical sequence, medicine that time was practiced which consisted appeasing of gods by prayers, rituals, sacrifices, and driving out evil spirits from our body. So funny, no? We think that it is all funny for today's date, but it was very much appropriate for ancient time. So there is also evidence that once the evolution started, the prehistoric man improvised stone and flint instruments for performing circumcisions, amputations, and tree fining of the skulls. We do tree fining till today. We do tree fining for intracranial bleed, means a blood which is collected around the brain or inside the brain, we can drain it out. So in the prehistoric era, man used to use stones or flints, okay, to perform these type of surgeries. So now Indian medicine. So it is very interesting to know about Indian medicine, which is one of the oldest system of medicine which has existed. For the record, not off the record, on the record it is existed since 2000 or 5000 BC. Okay. So truly Indian in origin and development, there are only two systems of medicine. One is Ayurveda and second one is Siddha. Ayurveda was practiced, or till today it is practiced throughout India, but Siddha system of medicine was born, originated, evolved in Tamil speaking states of South India. So, coming to the people or gods, whatever we say. So, Dhanvantri is Hindu god of medicine. He is born as a result of churning of oceans during tug of war between gods and demons. You might be watching Mahabharata, Sri Krishna. They show this literally. They show both demons and gods. They churn the ocean of milk. So from that ocean, Dhanvantri, Lakshmi, all goddesses, gods are born. So according to the literature, why I am telling you all these things, because their importance of medicine in Indian subcontinent was always there since we know our existence. So according to the literature, medical knowledge in Atharvana Veda has gradually developed into the science of Ayurveda. So coming to the ancient Indian medicine, so there are some celebrated authorities or celebrated people or great men who have contributed a lot of things to Indian medicine. So they are Atreya, Charaka, Shushruta and Vagbhatta. So Atreya, what literature says is he has lived in 800 BC in the University of Takshashila. He was a great physician and teacher. Second person is Charaka. He lived in 200 AD. He was a court physician for a Buddhist king, Kanishka. He has written Charaka Samhita. It compiles about 500 drugs, how to use all those drugs, adverse effects, and he also mentioned one of the famous drug we use till today, that is Riserpine, in the effective management of blood pressure. So coming to the next great man, that is Shushruta. He is called father of Indian surgery. Shushruta Samhita, according to the literature, it is written in between 880 BC and 400 AD. So this Shushruta Samhita is a devoted book for surgery, but it does not contain only about surgery, but it also contains about medicine, pathology, ophthalmology, hygiene, midwifery, etc. There are so many things which are written in Shushruta Samhita. So what is this hygiene? Hygiene was also a part of ancient Indian medicine. The proof for this is laws of Manu. We know Manusmriti. So the Manusmriti is what is called a code of personal hygiene. Not only that, archaeological excavations show that in Harappa and Mohenjo-daro, while excavating cities which were there for 2000 years old, so we could able to uncover advanced knowledge of sanitation, water supply and engineering. This shows since existence of human beings in Indian subcontinent, they were really interested about medicine, and definitely we were far advanced what we think today. What we think today that we were our ancestors were not advanced is a myth. So coming to the few words about Unani Tib medicine. So it is originated in Greece. Okay, it's a Greek medicine, but it was introduced in India by Muslim rulers in 10th century AD. So it was entrenched in certain towns and cities. Example: Delhi, Aligarh, Lucknow, and Hyderabad. Even till today, there is a Unani specialty of medicine which exists and treats also. So few words about homeopathy. Homeopathy was propounded by Samuel Hahnemann. So it is a system of pharmacodynamics based on treatment of disease by use of small amounts of drug that in healthy persons produces symptoms similar to those of disease being treated. Okay. So coming to the Chinese medicine, they claim that it's the oldest form of medicine. the oldest medicine which dates back to 2700 BC. So Chinese uses two principles, the yang and the yin. The yang is believed to have been an active masculine principle and the yin is a negative feminine principle. The balance of these two opposing forces meant good health. Okay, so they use hygiene, dietetics, hydrotherapy, massage, drugs, etc. The Chinese medicine till today, with the modern medicine, they have clubbed their Chinese medicine. Okay, so they believe that it is a oldest medicine, traditional medicine. Okay, so the Chinese system of barefoot doctors and acupuncture have been attracted worldwide attention. So Egyptian medicine. So as we know, Egypt is also one of the oldest civilization which has existed since, for the record, 2000 BC. Okay, so Egypt, it's also ancient Egypt invented picture writing and recorded their doings on the papyrus. Okay, it is one of the form of storage of their writings. Okay, so in Egyptian times, the art of medicine was mingled with religion. Egyptian physicians were also equivalent to the gods. One of the well-known physician was Imhotep, who was survived during, they say, around 2800 BC, who was famous as a statesman, architect, builder of the step pyramid at Saqqara, and he was also a physician. So Egyptians worshipped many gods. Imhotep was considered as both doctor and he was considered as a divine human being. So there were specialists for doctors in that era only, like tooth doctors, head doctors, eye doctors, etc. So Homer, speaking of the doctors of the ancient world, is considered best of all. Okay, is it audible? Okay, sorry, I am taking you little bit faster. Please bear with me. Okay. So the best known medical manuscripts belonging to the Egyptian times are the Edwin Smith papyrus. The date is 3000 to 2500 BC, and other one is Eber's papyrus. So the Edwin Smith papyrus, the oldest treatise on surgery, accurately describes the partial paralysis following cerebral lesions in skull fractures. See, these are all interesting things. So at that era only, they had used castor oil, tannic acid, opium, turpentine, gentian, senna, minerals and root drugs, which are all used by Egyptian physicians, which are all used till today also. Even we also use all these drugs. They had, Egyptians at that time only had described so many diseases like worms, eye diseases, diabetes, rheumatism, polio and schistosomiasis. Okay, schistosomiasis is a parasitic infestation. So isn't it interesting? Medicine existed since 5000 BC. Nice, no? So coming to the Greek medicine, from the Greek evolution of Greek medicine, we can say there is little bit attachment to the modern medicine. Okay, so the Greek medicine existed in the started, or the records says since from 460 to 130 BC. So the Greeks enjoyed the reputation, the civilizers of the ancient world. An early leader of Greek medicine was Asclepius. We still use the doctor's symbol based on Asclepius stick, okay, which is covered by two snakes. Okay, so there were two daughters of Asclepius. One is Hygeia and the other is Panacea. So Hygeia was goddess of health, or Hygeia represents prevention. Panacea was goddess of, or was treated as goddess of medicine or cure. Okay, so goddess of cure is Panacea. So by far the greatest physician in the Greek medicine was Hippocrates. So So he lived during 460 to 370 BC. He is often called the father of modern medicine. Till today we take Hippocratic oath. After passing your MBBS, you take Hippocratic oath based on his ethics. Okay. So see, he has a sayings of Hippocrates later became favorites with physicians such as life is short, the art of medicine are long, opportunity fleeting, experience treacherous and judgment difficult. So these were all his statements. So his famous oath, the Hippocratic oath, has become the keystone of modern medical ethics. So after all knowing, see there are still more medicines, Mesopotamian medicine, Roman medicine. You will get bored if I tell all those things. So I have cut short. So dawn of scientific medicine. So revival of medicine, I'll be telling few things. See, revival of medicine, it happened in 1453 to 1600 AD by a Swiss physician called Paracelsus. He attacked the superstition, he burnt all the old books, okay, written by Galen and all. So that step itself took origin of modern medicine. There was one more person, he was an Italian physician by name Fracastorius. He brought a new theory at around 1600 to 1700 AD, that is the theory of contagion. One more person, Andreas Vesalius, okay, he is called the first man of modern medicine. He has survived from 1514 to 1614. His work or his written book, it is called Fabrica, okay. So that was the classical text for medical education at that era. So after all this revival, something happened, okay, that is called sanitary awakening. Government of England during 1848 and 1875 passed two acts, okay, that is called Public Health Act. Why they passed such an act? Because the mean age of death in officials and professionals was 44 years of old that time. But laborers used to die. The mean survival of laborers in England at that time was 22 years. Imagine. So that made them to think, some great people thought sanitation is the most important thing. So they started to bring a law that is called Public Health Act of England. Okay. So that's how ancient medicine gradually people started thinking contagion. They brought germ theory. So eventually modern medicine started developing. So that is the next heading is rise of public health. See, we take cholera as the father of all the diseases, because from the outbreak of cholera only many people learned how the disease spreads, how contagion works. There is a river called Thames River. So Thames River, that time they used to use the same river for drinking water and also to dump all the waste, sewage water, sewage water, etc. Okay. So after that, people got aware from the cholera disease. A lot of outbreak happened. Okay, epidemic happened. Cholera epidemic came. Then the England government passed Public Health Act. Okay. So after this, great man called Dr. Louis Pasteur, he survived from 1822 to 1895. He demonstrated bacteria in air and water. So that gave a new ideology for infectious diseases. So he gave a germ theory of disease. Later antibiotics got developed. Accidentally penicillin G was developed. Okay. So later we got a cure for many bacterial and viral infections. So coming to the modern medicine. Modern medicine, mainly it is curative medicine, preventive medicine, social medicine. What is curative medicine? Curative medicine is, it's the medicine which is already for people who are suffering from disease. But preventive medicine is, it is for healthy individuals, right? So eventually we are today at this stage, we are aiming for health for all, and primary health care. How to give health for all? There is something called Millennium Goal, that is Millennium 2000 goal, which is still not yet achieved, and but we are on verge to achieve it. We are on the way. So you all youngsters should join to achieve all those goals. Okay. So health for all is either poor or rich, whichever uh, socioeconomic status may be, he should receive good health. So primary healthcare concept is the present ongoing concept where even the small villages where 20 to 25,000 population will be having one primary health center where people can go and get their disease addressed there. Okay. Thank you. Any questions? I think they all got bored with the history. Audible? Yeah. See, history, I know for many people it may be boring for you, but it is wonderful that how we got evolved. Yeah. See, there are two principles according to Chinese. Okay. One is yin and another one is yang. Yin is male, yang is female. If you combine both, so that will give cure for the disease. That is what they believe in. Okay. They should maintain the balance between yin and yang. One is feminine principle, one is the, I'll show you. Yeah. See, one is the masculine principle, another one is the feminine principle. They believe that they are two opposing forces. Okay. So they should be maintained in a balance to give you good health. That's all. Is it clear? Yeah. Okay. Any other doubts?
No, what is variolation?
What is?
Chinese practice variolation to prevent smallpox.
Yeah, it is something like a vaccination. They are the first people to give vaccination for diseases like smallpox.
Any other questions? You can either type or ask. Thank you, sir.
Thank you. Thank you.
Thank you, sir.
Thank you all.
Please fill the feedback, please.
Thanks, sir. Thank you, sir.
So you can leave the class. Feedback has to be complete.